How was you?
Hi, Sue Lavasser. I'm the supervisor of health services for the Westport Public Schools. And I don't know who to call on, so I'll call on Sue.
Thank you, Suzanne. Sue Pfister, Director of the Westport Center for Senior Activities, and it's nice to see everyone. And I will call on Dr. Oshman, who cannot comment on my suntan. Please.
So I'm not looking at your tan, don't worry, I can't see it on Zoom. So I'm Robin Oshman, I'm a Westport dermatologist. I'm representing the Fairfield County Medical Association on this meeting. And I don't see anyone else to call on. So maybe Margaret, you could help me.
I'll go, Margaret. Elaine Tano of Town of Westport Department of Human Services. And I'm going to call on Dan Woog. Welcome, Dan.
See you, Dan Woog. I run a local blog. Brian McGonigal.
Hi there, Brian McGonigal, founder of Westport Pride, and I was a minute late, so I don't know who has not gone. Melissa.
Hi, everybody. I'm Melissa McGarry. I'm the mother of 3 teenagers and young adults in Westport and a prevention professional working in Trumbull. I don't know who else has not gone. I was also late.
I'll go. Hi, I'm Adrienne Tober. I'm PTA Council co-chair of the Health and Wellness Committee, and I'm going to introduce my co-chair on this committee, Catherine Gardner.
Hi, everybody. I am Adrienne's co-chair on the Health and Wellness Committee for PTA Council. I have 3 children, a 7th grader, a 5th grader, and a pre-K. And I will call on Nina.
Hi, everybody. Nina Chanana. I work with Positive Directions as their local evaluator in Norwalk with the Norwalk Prevention Coalition. Thanks for letting me crash your meeting.
And you're a mom in Fairfield, so you're involved with a lot of prevention efforts everywhere you go.
Yeah, I work all over the state with different prevention coalitions.
Can people put their hands up if they didn't go yet, so people can?
Christine Wanner.
Hi, everyone. I'm Chris Wanner. I am the coordinator for health and PE for Westport Public Schools, and I call on Susanna.
Did you mean for us to put our hand up that way?
I think that's a great way to do it.
Or it just stays up for the whole meeting. I'm Susanna Lewis, and I'm the Director of Community Outreach at Silver Hill Hospital.
I can say I'm Ingrid Gillespie, Director of Prevention Liberation Programs, and I was going to call on somebody, but they disappeared, so I don't think I will.
I'm Lee Ballard. I'm on the board of Positive Directions and serve on the Westport Human Services Commission.
Hi, I'm Deirdre Echold. I'm a social worker for the Human Services Department for the town of Westport, and I have a rising senior in high school.
Hi, everyone. I'm Jen Tooker. I'm Westport's second select woman, a mother of 3, and super happy to be here today. Val.
Hi, I'm Valerie Babbage. I'm the coordinator of psychological services for the Westport Public Schools. Good to see so many people. And let's see, I'm trying to see who hasn't got. Oh, Mark.
Of course, just as my phone starts ringing. Hi, everybody. I'm Mark Hartog, Deputy Director of Westport EMS. I have 3 girls who made it through the Westport school system unscathed. I don't know who else needs to go. So.
I'll go. I'm Nicole Wachowski from MAD. I'm our program manager here for our youth department. And we have 2 of our interns on the call today, as well as our youth program specialist. So I will call on Rachel, our intern.
Hi, I'm Rachel, and I'm an intern with MAD. Oh, I'll call on Jenna.
Hi, I'm Jenna Schumann. I'm also an intern at MAD.
I'm the MAD program specialist. I'm Brooke.
And just in case anyone is new here and doesn't know, MAD is Mothers Against Drunk Driving. Denise, did you go yet?
Hi, I'm Denise Quayle. I'm Managing Director at Kids in Crisis. Oh, and let me see somebody. I'm not sure who else went. I just kind of jumped on.
How about again?
Did you go, Chris?
Raise your hands if you didn't go yet. I realize there's actually 2 screens of people. I think everyone on the first page. Anyone else hand up if you didn't have a chance to introduce yourself? Okay. Then I think we're good. Thank you all for joining us today. We are having a special meeting. It's great to have such a good crowd because we are really going to focus the entire time on going over the data that we got from our youth survey. It's exciting to have data, you know, even during a pandemic when things are obviously not normal, we thought it made sense to gather data from our youth because it's been a few years. We, you know, need to know what's going on today. It sets a new baseline. We did present to the Board of Ed last night, and some of the discussion was, you know, life's going to be different next year, but it may not be as different as we hope, right? It might take a couple more years to settle back. It still makes sense to have data now that we can measure progress against. And what we are going to do is really dedicate today's time to going over the presentation we did last night, but which was, you know, maybe a 15-minute presentation, but we can go a little slower and stop for Q&A as we go along. And then we really want to have discussion about next steps afterwards. So what I want to say before we get going with the presentation for those who are new is Westport Prevention Coalition is, we act as a subcommittee of Westport Together. We are funded through a state local prevention council grant that comes over to us here at Positive Directions. And the Prevention Coalition works as a partnership between Positive Directions, other treatment agencies, parents, schools, first responders, the municipality itself. The concept is really all of us working together because it takes a village, right? And our focus is on preventing substance use across the lifespan. Today, of course, we're going to be focusing on youth because what we're looking at is the data we gathered on our youth. But then the way that we address these issues is through 7 different types of strategies. There's a national model, and the 7 strategies for environmental change involve things like education, everything from sort of providing and disseminating information to developing education, creating alternative supports, changing consequences for behavior, creating new access or to positive things or removing access to negative things, and all the way right up to changing local ordinances and local policies. So there's a real range of things we can do, but we do it by working together. What I want to make very clear in case people don't know this is we have very little money for this. It's really about us doing things together, each bringing what they have to offer. And so I'm hoping that after we look at today's data, you know, we've spent this year, we've gathered data this year. We've done focus groups. Emily Melnick has presented them. We did, there was a parents survey last summer. We've been developing postcards that have gone home to people. Hopefully some of you have been receiving some of these cards, these informational cards, which are beautiful thanks to Lee Ballard's incredible graphic expertise. So these are some of the things we've done this year, and we've had some Zoom meetings to try to educate parents. But I think we're poised to do so much more in the coming year because we've got data. And so I just want people to start to get excited about that and go, I can be a part of the solution here. So right from the beginning of the meeting, I want to say we will meet again in July, same, you know, as a default, the same time and place, which is always the first Tuesday from 3 to 4:30. Once we hit July, we know a lot of people are on vacations, but we're going to say, let's assume that those of us who want to kind of work on stuff over the summer, try to stay connected at that meeting, or maybe we create spin-off groups to work on different activities. But we can do stuff together and come back really strong in the fall. I think that'll be very exciting. So that's my kickoff speech. I'm going to share our screen, and Valerie Babich and I are going to go through our survey data from last night. Please ask questions as we go along, either verbally or in the chat, and we'll have lots of time to talk at the end. And Elaine or Kevin, do you want to say something while I'm pulling up my screen? Anything else?
Margaret, as you're pulling that up, I wondered about how we plan to share the full report. I know we're going to be referencing it as we go through, and it might be helpful for people to know, what they can expect.
The full report is going to be on Positive Directions website, but we're actually like redoing that now. So I guess I'll drop it in to the existing website, but there'll be a new website in a couple of weeks. And Kevin, do you already have it on Westport Together, or will you?
So we will as well. On the Westport Together website, we have a survey tab similar to what Positive Directions has for past surveys, and we'll have that there as well.
Good question, Val. And that's the aggregated survey. And just so you all know, we have, what we're going to be doing today is really talking about the aggregate results from like 7th through 12th grade. But part of what we have the ability to do is to really dig in and look at, grade level data, to really slice and dice the data in a number of different ways based on different kind of demographic information, so we can really find out what's going on.
Right, and the schools will be posting their individual reports, Staples, Bedford, and Coleytown Middle School. I would imagine probably later this month or over the summer. So if you're curious about the differences in the schools, you'll have access to that.
I just thought I would just jump in and just echo a welcome to everybody who joined us today. Being behind the scenes and seeing how well Kevin Godburn, our Youth Service Bureau Director, Margaret Watt from Positive Directions, Valerie Babich, Suzanne Levasseur, I think Chris Wanner's on the call. The way that the school, the town, and the community have really come together to see this survey through is really nothing short of Herculean when it comes to, going through the proper channels. And I just want to kind of stress the importance of having data to actually guide what we choose to do in the future, both around programming and looking at developmental relationships and the importance of those relationships in the healthy development of our young people. So I want to thank all of you for coming. I want to thank all the people I mentioned and many others that are also on this call, in addition to the Westport Prevention Coalition, which is really a group of really dedicated both professionals and community members who really care about this topic. So while I think we'll probably focus a lot on the substance abuse piece, it really does come down to relationships and how we foster those. And so my hope for the future is that we can use the Search Institute's research around the 40 developmental assets and the importance of relationships in relation to that, to really educate all of our partners in Westport Together to be using the same language and to be guiding with intention. And so we're thrilled to have you here. Margaret and Valerie are a great traveling roadshow. So, we'll get more data to you as we go, and we hope to include you in our journey of kind of moving the needle a little bit in the future. So that's all. Thank you.
Okay. Margaret, can you advance the slide?
Sure.
So we're going to talk about the Search Institute Developmental Relationship Survey. And I do want to echo what Elaine is saying. The partnership with the Department of Human Services and Positive Directions is truly a positive one. And as you know, was funded through the local Prevention Council grant that was given to Positive Directions. Elaine and Kevin have also been just strong partners in getting this off the ground. And really appreciate that support and collaboration. So the survey was administered in late April to a random sample of almost 800 students in grades 7 through 12. Parents were given the opportunity to view the survey in the schools, and they were also able to go to central office if they wanted to see it. And they were given the chance to opt out their child if they felt uncomfortable with any of the questions. As we said, we're going to present the aggregate data for today, and you will have access to more information as we move forward. The process went really smoothly. We were pleased that it actually took less time than expected. And so that was important for teachers. The curriculum coordinators at the high school and our administrators at the middle school were just phenomenal in pulling this together very quickly. There was a very small window there, and we appreciated that. And the teachers were just awesome, again, in pulling this together quickly and using instructional time at a very critical time of the year, at the end of the year, to help us with this. So it was truly a team effort. So we did reach our target sample size. We were pleased that we had at least 30% in grades 7 through 10 and 20 to 25% in grades 11, 12. So we feel really confident about the data based on the numbers that we got. So yeah, we didn't present this at the board, but if you're interested, this is more of a breakdown of the students that we had. And again, these are the places where we can dig more deeply and look at different populations, gender, different race and different grades, and look more in detail in terms of what some of this data means. So as a reminder, I know we talked a little bit about the survey in the past, but there were 4 modules. There was the developmental relationships module. There were drug-free communities, which basically is our questions on substance use. And then there were 2 modules that were only for our high school students, and those were COVID-related questions and racial injustice.
And for anyone who's new here, the reason it says Search Institute at the top is that's the name of the agency that, or the nationally known research nonprofit that created this survey that we used.
So with a couple of points that we just want to highlight before we begin to review the results, interpret what it means about high school and middle school students in Westport and their experiences. First to note is that it was a first administration, so this now establishes a baseline for us moving forward. We did administer the survey, as we talked about, during a pandemic. So all the results really should be viewed within the context of that. In the report, it talks a lot about not providing norms. So that the most important context is our local context. And Search Institute does mention several places in the report that it's not, the results are not necessarily to be compared to other towns, but more to look within. And look within our context and see what that means for us. There are benchmarks provided in the report that do give us some more sense of comparison in that way, based on the data analysis that Search has done over the years. And there also are some references to a pilot survey that Search did with adults, with teachers, but they were not Westport teachers. So while that's in the report, it's not a direct comparison for us. The survey is just one data point, so we'll be reviewing the data in comparison to other sources, looking for consistency and patterns that may validate or raise questions about the data. And really, I guess today is a good first step. We want to look at this data from multiple perspectives with multiple stakeholders, with a representative group like we have here today. Both within the schools, but also within the community. So that will be important to do. So I'll turn it over to Margaret to get more into some of the results.
Great. So I will present the sort of an overview of the data from the first 2 modules, which are the developmental relationships module and then the substance use module. The DR module really is based on the concept that relationships are fundamental to learning and to life. So, the DR module has 3 core measures that you can see on the screen, and I'll go over the data from each, or the summary data. The first core measure is basically the framework itself, and it has 5 elements. So basically, we're looking at whether students feel that their teachers are expressing care for them, challenging their growth, providing support to them, sharing power, and expanding their possibilities. And now we'll look at each of those in the form of a bar graph, where you see 5 of the bars correspond to the 5 elements of the framework. And the first one is an overall score. So I have to make sure everyone's clear on the fact these are not percentages. This does not say that 57% of students have developmental relationships. These are scores that are based on averaging student responses on a 4-point scale and then converting them. So what you really want to look at is overall, how are we doing? And what the red marks on the screen show are the difference between what's considered a moderate rate, a moderately strong set of developmental relationships, or strong. And so there's also weak down here. And what you can see overall is that the Westport students are reporting moderate to high developmental relationships overall and on several aspects of the framework, and actually strong relationships in terms of whether they feel that their growth is challenged by their teachers. And even the weakest area is still basically moderate. So, in the context of a pandemic, we think this is actually pretty great because we all know how challenged our relationships were in the last year and a half. And if you came into the school year and didn't even meet your teacher in person for months and months, this seems to really point to a really great effort on the part of the teachers. But we can go deeper into this model. And now you see the same 5 elements and 20 corresponding actions, which were specific measures that students were asked about. And here, what we found was for 15 of these 20 actions in the second column, the majority of students felt extremely or moderately supported by their teachers, which is again, fantastic. There were 7 of these actions where a minority, but still a significant minority of students felt only a little supported. And then we're able to drill down and see where are sort of the areas that most need improvement. And what we found was the 3 areas where there were, 20 to 30% of kids who felt only a little supported were all the bottom 3 that you see here that are associated with expanding possibilities. This is where students were asked if they felt their teachers inspired them to see possibilities for their future, exposed them to new ideas, experiences, and places, and introduced them to people who could help them grow. So when we talked about this information, we really felt that of all the elements of the framework, this is the most forward, sort of future looking. And this was the year in the pandemic, maybe where everyone was just trying to hang on for dear life. So I think as a board member last night said, this was survival. We were in survive mode, not thrive mode. And maybe the thriving is yet to come. So I think generally we feel, our students are reporting that they have moderately developmental relationships with teachers. And, we can remeasure and see how that changes over time. Now, the next core measure is students' self-reported social emotional skills. And this was a huge strength for Westport. As you can see here, the overall score, 60% of students said they have strong social and emotional skills. Another 37% say they have moderate skills, so basically 97%. The other lines on this graph are the breakdowns of the social emotional skills, and this is according to a national model from Castle. So it's aligned with what the schools are doing in their social emotional learning initiative. You're trying to develop kids' self-awareness skills, self-management, responsible decision-making, relationship skills, and social awareness. So generally, you can see these are all strengths. And then what's relevant here and how this all fits together with the model is, if you can see the line that popped up on the bottom of the screen, youth who have stronger developmental relationships with adults in their life, in this case, teachers, also have stronger social emotional skills. And then social emotional skills correlate with academic performance, behavior management, lower rates of substance use, more positive mental health, all the things that schools and community and parents are looking for. The third element of the developmental relations module is called equitable practices, and it's really looking at the larger context of the schools, like the culture of the schools. So really the kids answered 5 questions about how culturally responsive the schools were. And as you can see here, we have 61 is the score, again, not the percentage, it's a score of 61, very close to, it's high, moderate, very close to a strong score. So it's a moderately culturally responsive environment. And they were also asked to respond to the statement, there are adults who have similar racial or ethnic backgrounds to mine and who I consider good role models. And here we have a split. Okay, so, close to 40% of the kids said that's a little or somewhat true. And just over 60% said that's mostly or completely true. So we can, when we dig into the data, we can look at, the kids who answered this way, how did they show up on other measures? The kids who answered the other way, how did they show up on other measures? We really have a lot of abilities with this data. Once again, the reason these are the 3 core measures that go together is that students who feel that the schools are more responsive to them and from a cultural perspective, again, have stronger social emotional skills. So what we're basically looking at with this element of the survey is, if you have the relationships with the teachers and if the culture you're living in feels responsive to you, all of that supports your development of social emotional skills. And then that correlates to the behaviors and the learning and the growth that we're looking for. My next slide will be going on to our substance use data. So I want to pause here and see if there are any questions about this component or any comments. And just please unmute yourself. And I want to ask Kevin or Elaine if you guys can monitor the chat, because when Val and I are presenting, we're probably not really seeing that.
Absolutely.
So I don't hear anything. So let's go on to our substance use data. But really, at any point, you guys can just jump in with questions, okay? Or we can go back to a slide. But we are the Prevention Coalition, right? So the substance use data is very interesting to us. It's called the Drug-Free Communities module because this is the data that all the drug-free communities, which are organizations that have a CDC grant nationally, use these same core measures. So it's the same data collection nationwide, which is good for comparison purposes. And I'm going to start with this line graph showing current substance use among Westport students. The measure, the proxy measure for current substance use is students' reports of using a substance in the 30 days prior to the survey date. The survey was administered at the end of April. So we're talking about what substances may they have used in between March and April. For context, think about the fact that, the mask mandate was still there. A lot of our quarantine restrictions were still in place. So kids were at home a lot, theoretically. And what you can see here is we have 5 colored lines for the 5 substances students were asked about, and we can see the change in use rates from 7th through 12th grade. We'll start with the good news, which is that the pink line, which is tobacco, and the teal line, which is prescription drug misuse, so not things that were prescribed to them, those lines are basically flat at 0 to 2% in any grade. So these are not issues we're really concerned about. The top line, which is probably the most striking, is alcohol. And what you can see here is in our middle schoolers, we had 9% of 7th graders and 9% of 8th graders, so 1 out of 10, who reported having been drinking in the past month. And the question about drinking is explicitly says more than a few sips. Then that line rises throughout high school, reaching a high of 60% among our seniors. So 6 out of 10 seniors drinking in the past month, or a measure of current use, which is high. The other 2 lines, the orange line is marijuana, and the sort of aqua line is vaping. You can sort of see that there's barely anything happening in middle school. In 9th grade is where it starts to grow, with vaping being higher than marijuana, and then 10th through 12th rates are virtually identical. And I will comment here that the rates rise from 9th through 12th grade. That's not really surprising. You tend to see that in most substance use behaviors in high schoolers, because when you think about it, they have, as they get older, they have more parties, they have fewer restrictions on their time. There's definitely often, there can be a culture of people sort of turning a blind eye to behaviors as kids get to 11th and 12th grade and are heading off to college. We heard that in focus groups with teens and adults back in the fall. And the other thing is that, if you go to a party and you see a kid using a substance and you don't see some immediate negative fallout from that, that can decrease you know, that you may interpret that as like, oh, I guess it's not as bad as I've been told. So it decreases perception of harm. And perception of harm is one of the measures that we look at as a way to try to, you know, if people know something is bad for them, they are less likely to do it. So you want perception of harm rates to be high. Any questions on this graph?
Yeah, I have a question. This is self-reporting.
Yes.
How accurate do you think it is?
So people do like to ask that question. You know, it's an anonymous survey. So in terms of kids fearing that, you know, someone's going to find them out, they were assured up, you know, up, down, and sideways, that it would remain anonymous and confidential. There's literally no place to put in your name or your email. So generally speaking, the anonymity should help ensure accuracy. And then Search Institute and CDC, actually this whole module is used by the Centers for Disease Control. So it's a set of questions that have been studied over time and validated as much as any data can be, as any questions can be. So I think we really think that they are pretty accurate. At the Board of Ed last night when we presented, there was a question about, could this be underreporting? And my answer to that was, I mean, I hope not. But you know, I don't think it's likely to be over-reporting. Nina, you're an evaluator. Any comments on that question?
I think a good rule of thumb to use with this data, and I think Search Institute, who's been working on their youth surveys for 30 years, would say worst case is plus or minus 5% for these types of data points. And I think that's probably accurate. I really find that the youth are very honest in their self-reporting in my experience. So I really would say that plus or minus 5% is a good rule of thumb. But yes, I would say it's probably accurate.
Thanks. Any other questions?
Yeah, I was wondering, it's interesting to see the rise, and I know we're looking at high school students. Do we have
middle?
And middle school. Do we have any data on what happens in college? Do these lines continue to go up, or do they flatten out, you know, when they get into college? Does anybody know? I know it's not on the graph.
Right. Yeah, because we just did this within Staples and the middle schools. I mean, certain behaviors certainly increase in college, but like, you know, looking at that alcohol graph, is it more than that? I'm not sure. Nina or Melissa.
I was going to say there are colleges that survey youth and they do collect this kind of data, but there is no nationally reported college age data. So it's I mean, I think you have to look at the individual institutions and what they've seen. So it's not something we generally could speak. I wouldn't sort of feel comfortable with that unless we were talking about a specific college that had surveyed. So
I mean, one
answer.
You're seeing more grants going to colleges to address this kind of substance, but generally speaking, colleges aren't super keen to publish their drinking data. I mean, unfortunately, it's not great for their publicity typically.
I mean, another thing to think about too, though, is in terms of vaping, I think it would be probably safe to guess, not assume that vaping rates are probably higher in college, because vaping rates were higher even just a couple of years ago before the Tobacco 21 law went into effect in Connecticut and before the EVALI illnesses took place, and that sort of tamped things down, I think. But tobacco is legal over 21. So vaping, I mean, you just anecdotally, when you talk to kids on college campuses, they report a lot more vaping. But the others, I think, what everyone said about the data, it's going to vary by college as well, right? Melissa, is your hand up again, or is that from before?
Yeah, I had another question. This is any alcohol consumption in past 30 days. Do you have the binge drinking data?
It asks about perception of harm from binge drinking, but it does not ask about actual binge drinking.
Gotcha.
This literally only asks the 4 core measures. So for everyone, the data that we're looking at is we have, you know, the past 30-day use, which is really actual use of data. And then we're going to look at what do students think their parents' perceptions around substance are, their peers' perception around substance, and their own perception of the risk of harm. So those are what are called the 4 core measures. Shall I move on? I'll go ahead. So, okay, so this is the chart that's highlighting, who's using, what % of kids are using by grade. So I'm going to now focus on alcohol, marijuana, and vaping as the top 3. So let's go back and look at the positive. So from a positive perspective, across all the grades, we really only have 3/4. We have 3/4 of kids not drinking. Let's focus on that positive, that the majority are not drinking. 3/4 drinking means 25% are, so that's still significant. But it's really important for kids to realize that they're in the majority if they aren't using, right? I think the perception is pretty much could be the opposite. And I think a lot of times parents think, oh, everybody's doing it, or, I don't want my kid to be the only one who isn't at a party. But actually, look at our data, 3/4 are not. So let's support that. The breakdown that we saw in the graph, this is just to break down middle school versus high school rates. So across all grades, 25% are drinking. That's 9% of middle school, 33% of high school. We don't have a real measure during COVID to compare them to. There are surveys that are not yet published in other towns during COVID, but I did want to note that this high school drinking rate during COVID is higher than the state average in 2019 prior to COVID. And that is, somewhat concerning because theoretically kids had less, they were socializing less and maybe had less access to alcohol or more barriers or more parental supervision at the time of this survey. And then as we saw, the seniors are in a category by themselves. Marijuana, same kind of trend to highlight, right? The vast majority, 90% are not using marijuana, but there are 10% who are. Virtually all of them are in the middle school. That rate of 15% is lower than the state average in 2019. Again, we may be seeing the impact of a valley of the Tobacco 21 law and the impact of COVID. People are wearing masks, makes it a lot harder to, well, I guess this is marijuana, but marijuana is illegal and kids were at home more, and hopefully their parents were noticing what they were doing to some extent. And by 12th grade, it is 1 in 4 kids. Vaping, again, some very similar statistics for vaping and marijuana, 90% not using, 16% of high school students are vaping, 1/4 of 12th graders. Now we asked them also, we added supplemental questions to say, what are you vaping? And we gave them choices of, do you think you're just vaping like flavors? Are you vaping nicotine? Are you vaping marijuana, meaning THC? And they could choose multiple or none. And we found 1/3 said they vape nicotine only, so they're not trying to vape marijuana. 2/3 said they do vape THC. Just to highlight, both of those are bad for youth's lungs and brains. Both of them are highly addictive. And one of them is still illegal as of today, possibly not after tomorrow night's vote. And about 30% of them checked off multiple boxes. So they were willing to vape different substances. And then, not sure what we're going to do with this fact, but 13% of the students actually weren't aware of what they were vaping. So from a parental perspective, that's its own issue, right? Any questions on any of these statistics? All right, I will move on to a couple of slides about the students' perceptions. So the CDC and the drug-free communities ask students about whether they think their parents disapprove of substances and their peers do, because those are protective factors, right? If you think you're going to get in trouble, if you think your friends aren't into something, you are in a culture that supports, you can be in a culture that either supports or doesn't support substance use. And there are implications for our prevention work, right? Because if disapproval rates are high, we don't have anything to do on that side as much, but if disapproval rates are low, we should work on that. So the vast majority of students said that their parents disapprove of drinking or vaping. And a smaller majority said their parents disapprove of marijuana use. But look at the change from 86% to 63%. So by senior year, seniors don't think their parents disapprove of marijuana as much. In terms of their peers, a majority of students think their peers disapprove of substance use, but the rates are much lower than for parents, right? From 63% for marijuana to 77% for alcohol. And then there's a culture change, or like a complete switchover. By the time they're seniors, it's no longer the majority thinking their peers disapprove. Now the majority think their peers do not disapprove for marijuana and vaping. And the specific numbers, if you can see them at the bottom of the screen, 68% of them said their peers still disapprove of alcohol, although we did see alcohol was the most used substance. But we have low peer disapproval rates for vaping and particularly low for marijuana. So really 1 in 4 seniors says their peers disapprove of marijuana. That sounds like 3 out of 4 seniors are in a cultural group that supports, in a friend group that supports marijuana use. Now, in terms of what they perceive as risky, which again, if they perceive harm from a substance, that's a protective factor. So we have almost 8 out of 10 students. This is Melissa's binge drinking question. This isn't their actual binge drinking behavior. This is what do they think about binge drinking? Drinking 5 drinks or more at one time is binge drinking and is dangerous. Doing it 1 to 2 times a week, 80% of them think that that's, rounding, 80% think that's harmful. That means 20% don't think it's that dangerous. But I want to say that binge drinking is associated with everything from accidents, falls, drownings, sexual assaults, fights, all kinds of things. Then a similar percentage think that vaping is harmful, and fewer than 60% think that smoking or using marijuana a couple of times a week is harmful. Literally using marijuana a couple times a week as a teenager is the time that it is most harmful to your brain. And in particular, looking at marijuana, a number that stood out to us was that kids in 7th grade, so still just in the middle of middle school, we only have 3/4 of them thinking marijuana is harmful. As I mentioned before, when we were looking at the graphs and so forth, the perception of harm tends to decrease as you get older. So if you have a low percentage of 7th graders, relatively low, thinking marijuana is harmful, and then that keeps dropping, then obviously by 12th grade, you have 34% of them thinking it's harmful. So this is one of the ways that we can use this data, is to say, what are we teaching them in 6th and 7th or 5th, 6th and 7th grade? We want 100% of 7th graders to know how bad this is for you, right? So that's the last of the substance use slides. I'm going to stop sharing for a minute so we can see faces and see comments and questions.
I have a question. What, with so many kids drinking, yet they think more kids drink than use marijuana, but the perception is that marijuana is less dangerous. Do you know why?
Isn't that interesting? Well, I don't think we know why. We could certainly theorize things about the fact that it's been medical and quote unquote medical in the state for a while, that there's consistent discussion about legalizing it for recreational purposes. But what I think is relevant is if kids don't think it's harmful and they're in a cultural group that thinks it's acceptable, they are certainly more likely or at higher risk of then at some point starting to use it, even if they aren't using it that much yet, right? So I think of Robin's question about what happens when they go to college, and it's like, okay, well, so 1/4 of them are using a substance that is currently illegal when they're in 12th grade, and 60% of them are drinking. That's also illegal. But, when they go off to college without these kind of protective factors of, oh, this is bad for my brain and people around me, think that it's bad for me, I think that there's a risk that that number would increase. Elaine?
And I would just add Another factor is access, just general access to alcohol. For the, your average teenager, it's still easier to get your hands on alcohol if that's, if you're looking to do some kind of substance use.
Especially in a pandemic.
Typically,
when they were home more.
Mostly, majority of the teens would say it's from a private home that they're getting the alcohol, whether their own home or a friend's or at a gathering where it's been, provided. I don't have that data for Westport, but that's what we usually see when we ask.
I was going to say the same thing, Nina. And I think the other thing that's really interesting from my own personal experience and working with kids is we've spent so much time educating them about alcohol and, the drunk driving, the statistics and the things that they've learned along the way has been so focused on alcohol and the harm that marijuana, even though it's not new, is still kind of new in the mainstream discussion. So that's just my best guess. But I do think that even with our teen awareness group that we work with, we often go back to alcohol because that's sort of the roots of where we started in kind of managing and trying to spread awareness and prevention messaging. Phoebe, are you raising your hand? Oh, we have a student who from TAG who would like to chime in here.
Yeah, so I'm in TAG and I go to Staples and I just wanted to chime into that, with the DARE program. I'm guessing some people here are familiar with that. I don't really remember them talking at all about marijuana. It probably wasn't as popular then, but still basically all we talked about then was alcohol. And it was also in 5th grade. And in my opinion, and I think I've talked to other people about this, they think it would be more impactful if DARE and other programs are implemented during middle school, because that's kind of when people are more getting influenced by that stuff. And you could see in the data that, that's what was happening.
One other interesting point is that we've seen pro-marijuana campaigns that target kids saying things like, marijuana is so much better than alcohol. Alcohol is so bad for you. And marijuana has all these quote unquote beneficial, benign attributes. So kids are absorbing that as well.
Margaret, I just have a question. The vaping THC, is that included in the marijuana numbers as it's kind of a different bar graph? Is that?
Yeah, so so Search asked these questions about, they asked the kids the same questions about marijuana and vaping separately. But when they said vaping, that literally the vaping question said vaping of nicotine or marijuana or anything. So the marijuana numbers, it could be vaping, it could be smoking, it could be using it in any way. And then the vaping numbers could be vaping marijuana or vaping nicotine, which is why we added an extra question on to just say, when you vape, if you vape, when you vape, what are you vaping?
Okay, thank you.
But, increasingly what kids are vaping is marijuana more than there's just less nicotine and more marijuana. So that is part of the change that's happening.
Just
oh, sorry, Val.
No, finish, Sue.
No, I was just saying when we started looking at this, it was all, we were, really only knew about the flavors, and that was the big concern, even taking the flavors into the lungs. And then we slowly found out that, the flavors were kind of the least of it.
So that's what I was going to say, is that I think, it's a really important place for parent education, because I think parents, it took us a while to get parents to become aware of vaping, because it was something that could be so under the radar. Parents didn't even know what to look for in terms of devices. The fact that it's odorless and all of those things made it less detectable. And then the message was that it was nicotine. And I think we need to help parents know that, okay, if your student is vaping, there's a high probability that it's THC and not just nicotine. So I think there's a place for education there.
Margaret, one question about these surveys, and maybe Nina as well, is that the terminology, and we have a student on here, which is awesome. From my own kids, when it's THC, they don't call it vaping. They call it dabbing, or it'll be using a pen. Like, it's just not the same terminology for kids. And I wonder whether that ever causes confusion when we're doing these surveys.
We've certainly had those conversations about the different language. So the vaping questions I know were phrased, it said like, the questions that Search had in there about vaping literally said in parentheses, you know, nicotine, marijuana, THC. They listed a bunch of options. I don't think it used the word dabbing, but at least it made clear that like you could be vaping one of these substances. I think it was probably relatively clear. In the question that we added, Nina, where we asked them, you know, when you vape, what do you vape? We gave, again, a bunch of options. We're like, is it like flavors? Is it liquid? This, is it?
Right. We broke it down as specifically as we could.
Yeah.
I do want to add a comment about just Val talking about when you were talking about parent education around vaping. You know, we saw like an explosion of vaping. Obviously, many of you probably witnessed it 2 years ago. Youth and teen vaping was off the charts. It was new territory. And I think there was a real concerted effort, you know, not only in the state, but in the US and locally, to get information out to as many people as we could about, you know, what is vaping? What is the liquid inside it? What is it doing? Is it harmful? And it really made a difference. And I think, you know, even though we still have some more work to do, it just shows you how sort of a concerted effort can make a difference. We saw it with tobacco. We've never seen that with marijuana. And I think it shows in the data. You know, when I did, I was part of that group that did statewide focus groups last year, and we actually had some Westport groups. And I can tell you that the youth we talked to, their parents would talk to them about substance use and alcohol use, but not marijuana use. It was like parents almost shied away from it because they didn't know the messages. They didn't really know what to say about it. So I think we have some challenges with that. And I think it, you know, in terms of looking at national data, alcohol use rates are kind of starting to level off. And we're not seeing that with marijuana. I think we need to kind of think about what the messages need to be, and that there should be messages, because, you know, Margaret didn't have the ability to do this with the data yet, but eventually we can take the data that asks about parent disapproval, and we can look at the kids that feel like they believe their parents disapprove. And I can tell you right now, their use rates are going to be much lower than the use rates of the kids who report their parents don't really disapprove, and, you know, without a doubt. So it's important to think about those messages and how we sort of share that information.
Yeah, I was wondering if I could ask a question. It's interesting that 20% of the kids didn't think binge drinking was dangerous. Are those the same 20% that also felt they didn't have emotional support or role models? Did they fall into that category, or was there no relationship to that?
Robin, we haven't been able to spend enough time to disaggregate the data like that yet, but I'm writing down these kinds of questions because we can look at that. And I think, you know, what's so important here is all this talk about the education, like what Phoebe said about, you know, when are we educating kids? And also when, you know, education isn't like one and done, right? So it's like, if there's DARE in 5th grade, then what happens in 7th grade or 9th grade or 10th grade? And then what are we saying to parents? You know, Nina said it well, right? Like parents, I mean, there's like a couple generations of us as parents who don't know what to say to our kids about marijuana. And we stopped learning about marijuana either when we had our own drug education classes or when we used whatever substances we may have used. And then we never noticed what happened in the world after that. So, you know, I will say again, like with these postcards that we've made, these, the marijuana postcard in particular, I think, Kevin, do you want to comment, or Adrian or anyone, on some of the feedback? Because I think parents are finding these really useful in terms of like, oh, here's facts that maybe I didn't know, and now here are conversation starters with my kids.
Yeah, I was just gonna jump in and just, I mean, you know, comment in terms of the education and, bringing parents up to speed. One of the things that we've mentioned over and over is just from a product standpoint, what's out there, the higher concentration of THC and everything is so much, it's so much greater than what, even parents who may be familiar with it, are used to. And now, as we're, on the cusp of what's likely to be legalization in the state of Connecticut, and that, what we've seen happens with the perception of harm. And we know from, the language in the bill that even the legal consequences for, possession are shockingly light for youth. That there's a good opportunity to really put a lot of effort into educating parents about what's out there, about the delivery methods, about the risks, and educating students certainly about not only the risks, but also what kind of supports and resources are available for those students that are using or find themselves needing help.
If I could just chime in about the education piece, this is Chris Warner, Coordinator for Health and PE. We have programming that goes from 6th grade through 11th grade where students are taking health classes, and this is certainly part of the content of the health classes. It's approximately a quarter credit per year that students are getting for class, and of course, substance abuse is only one segment. And to me, it just speaks to the possible need of, making somehow a wider reach than what we're doing just at the high school level. So just some input on that.
That's great, Chris. I see Jenna, and then I want to come back to Chris too.
Hi, so I'm Jenna. I'm from Massachusetts, but I'm in college now, so I don't know how much the DARE program has changed since I took it, but I did in 5th grade, and I want to say I do agree with Phoebe. I feel like it's not as helpful when you're in elementary school because you don't experience it as much until you get into middle school. But I also think it's important that they don't really include the parents. At least when I did the DARE program, they don't talk to the parents and explain to them what they're teaching their kids. And the only time they really saw the DARE program was when you graduated DARE and the parents joined. But even then, they're not really learning about what they're teaching their kids. And as you know, most times when you ask your kid, what'd you do today or what'd you learn today, they're not really going to tell you everything. So I think it's important to almost include the parents in that program as well, so they can also know how to talk to their kids as well.
Does Westport offer the new DARE program, which is Keeping It Real, or do they still do kind of the traditional DARE program? Does anyone?
There actually is no DARE program in the Westport schools anymore. I don't think we have an officer on the call. Mark, I don't know if you can speak to it, but to my knowledge, DARE hasn't been in existence in a while. It was actually funded by the community at one point. So there is no program, no formal program, although it's covered, of course, in the health curriculum.
Because the new DARE program that they came out with, which is evidence-based, is 10 sessions that they do in classroom. And it's different than what probably the young people remember. It's more communication and decision-making and how to deal with stress. And so it's more soft skills than it is kind of the facts about drugs, which is probably what you remember from being in DARE, and what my own 9th grade daughter got in 5th grade at Saugatuck. So
this may be an opportunity for us to really, look at, maybe that might be a recommendation that we revisit, that program. I'm not speaking for anyone here. I'm just saying it's such a great point. And I'm glad you mentioned it because I know that TAG actually was going into the classrooms with DARE. And I thought that was really powerful, that peer-to-peer model as well.
Well, and I think in terms of, possible recommendations, one thing we could be looking at that goes to Jenna's point about involving parents and youth is looking at doing something like the Freshman Forum, which some of us have been talking about throughout the year. So Melissa works in prevention in Trumbull, and Trumbull started Freshman Forum 15 years ago at this point, I think. And that is a It's different from the risky behaviors forum that Westport has done in the past, although not in the last couple of years, because you do it for the rising ninth graders and their parents. And it's universal, right? It's not like an optional thing. You're really trying to get all the kids and all the parents there for an evening, or, for a time and space dedicated to some like really solid education and resources. And then hopefully that's just the beginning of an ongoing thing, but at least you make sure everyone gets certain information at a key point in time. So I'm hoping that one of the things that maybe we can work on in the summer with whoever's interested is, what could that look like in Westport, and what could we do, like for next fall? Kevin, Melissa, and I, and a couple of other folks had 3 or 4 meetings this year to really look at who does freshman forum in our area in different ways. So we can talk about, pros and cons of different models and what would work in Westport. And, is it a full-on thing? Is it freshman forum light? But the thing that would be required is to have community volunteers to help put it together, especially parents. Some youth would be really great, but we definitely would need the schools kind of to say, we want to work on this with you to see how it would happen.
Yeah, and that's something.
Nina's leaving. Happy graduation to Kira, Nina.
That's actually something that Chris Warner and I have been talking about, and would be interested in hearing more about how the other towns are managing it, and how we might put something like that into place for next fall. I do think it would be more effective than risky behavior, and the idea of having parents and students together and beginning that conversation, I think would be helpful. I am aware that we're talking about ninth grade, right? And we talk about, start early, talk early, talk often. So there's probably still more to do at the middle school. But I think, that's certainly a place where bringing them together, I think, is very effective for ninth grade.
Margaret, at the very least too, we can always get you guys handbooks for, we have the middle school handbooks and the high school. So even if it's just like mandatory to give out in the first day of school or first week of school for either of those populations, we definitely can do that. And those are all for parents' education purposes.
That would be awesome, Nicole. Thank you.
I also wonder about opportunities. We see big jumps going into 11th grade, right? So it's kind of like kids get their licenses, they get more freedom, they're getting ready. So I always wonder about the opportunities to work with the driver's ed programs in town, because really all kids seem to go to 2 driver's ed schools, and parents have to attend, I think, a 2 or 3 hour education session with their kids. And I think there's probably an opportunity to also re-inject some information that's local and relevant to what we know about Westport into some of those lessons, right as we're getting ready to see the jump in substance use.
That's a nice idea. And at a minimum, I mean, giving them resources and going, here are things to give to the parents when they come to that meeting, if they don't want to like revamp their curriculum or bring in a speaker or something. Yeah. I thought I saw someone else's hand up. Anybody else? Well, okay, so we actually have we have 2 other modules that Val can present that are no longer the substance use models, but other aspects of the survey that we want to go over with you all. Oh, so I forgot, I had pictures of our marijuana postcard here. At this point, the 4th postcard has gone out, and then there will be another couple in coming weeks. So back to you, Val.
Yep. So the current events area had 2 modules, the COVID-19 module and racial injustice. So in terms of COVID-19, it was exploring the impact of the global pandemic on our staple students. Margaret, if you could go to the next slide. And you could see that almost 70% of students experience the pandemic as somewhat or very stressful for them. And we found that that was consistent with first of all, what we've been hearing in the media about the impact on teens. And even here in school, we've had, a smaller group. I mean, this kind of splits into thirds, and we've certainly had about a third where they're really struggling and having a hard time, with that third, that's sort of somewhat that middle group. And then a third that seemed to be kind of adapting and adjusting more easily. So that seemed to be an accurate reflection. And then in terms of their coping skills, more than half of the students took steps to resolve the problems related to COVID, most or all of the time. And then about half tried to think about what they could learn from it. So again, that half and half certainly makes us wonder about the other half and how they were trying to cope with this very stressful event and an area to be explored. The majority of students accepted that COVID was a reality and could not be changed, which was a positive. And then it was also worth noting only 34% reached out to other people about how they were feeling about the pandemic, most or all of the time. Again, another area possibly for us to explore about encouraging students to be able to reach out to others about their feelings and making sure that we have people on the other end for them to reach out to. In terms of their connections during COVID, we found that a little more than half, so 58%, reported that they agreed or strongly agreed that felt connected to staff and other students in school. Certainly suggests again that we have some work to do with the other half and reaching them. However, the majority of students agreed they feel connected to friends, which was really good to see. Almost 90% of the students feel that their relationships with family and friends was about the same or stronger during COVID, so another positive. In contrast, less than half of students felt their relationships with teachers were about the same or stronger. Again, we hypothesize this may be due to reduced contact with teachers during the hybrid model, a lot of quarantining in and out during the year. Certainly, teachers, I think, were doing the best they can, but they were also dealing with enormous stress. So it makes me wonder what the impact and what these numbers might have looked like if we had stayed in hybrid or remote for longer. I think the fact that we were able to get students back when we did was a real plus. Looking more specifically at social emotional support, almost 50% of students felt their relationship with teachers helped make things feel more normal during COVID, and similarly help them understand and make sense of their feelings during that time. And 65% of students agreed or strongly agreed that their teachers provided a safe space for them to share their feelings and experiences related to the pandemic. So again, an area for us to explore, think about where we need to strengthen our social emotional learning skills at Staples, making sure that teachers feel equipped to help students navigate their feelings and hopefully not another pandemic and their experiences related to that, but whatever is coming up for them in that social emotional area. And the last module for our high school students was the racial injustice model. And this was actually, these are the questions and how it was introduced to the students. It was looking at their role in eliminating injustices against people of color and the efficacy of their beliefs. And you can see that 3/4 agreed or strongly agreed that they believe they have a role to play in ending injustice. The overwhelming majority of students feel they are more aware of the impact of their words and actions, more likely to take action in the fight against racism and discrimination, and almost all believe that by working with others in the community, that they can make things fair to people regardless of the color of their skin. So I think out of all the data, this was probably the most clear. It was a very consistent picture in terms of how our students at the high school are thinking about all of the racial injustice uprising. And then in terms of next steps, as I was saying earlier, we're going to review the data with the school community. We're going to be starting at the administrator level, sharing it with staff. At the district level, Chris Wanner and I have already talked about her talking to the health teachers. I will be sharing it with our mental health staff. We'd love to get student input, so thinking about how we can reach out to middle and high school students and get their thoughts, even just hearing from our students on the call today, that we want that student voice and perspective as we try to interpret what this data means and eventually come up with recommendations, whether it's for possible curriculum changes when we look at health, student programs or parent education programs, pulling all of our efforts together in terms of prevention. And then obviously what we're doing today with this Prevention Coalition, getting the input from community stakeholders and looking together about how we can all work together from the community, school, parents, you know, all in our efforts to promote positive youth development for our students. That's it.
So,
Any questions
other-
on any of those modules?
So I thought the social injustice was interesting. What about teaching them tolerance? You know, it's one thing to say that you promote justice for certain groups, but I know, you know, just reading the newspaper, you have the far right, you have the far left, and somewhere in the middle, there's some tolerance that needs to be given to everyone in the community at large. And I was wondering if we can expand racial injustice to improving tolerance from the individuals that we have in our community.
Well, you know, this is an area that's being explored in the schools. I mean, from the one perspective, there's a DEI study going on across the district, which hopefully will lead to recommendations about where we can improve. I know that our social studies coordinator is certainly looking at that in terms of how we, you know, have those conversations at the middle and high school level. I mean, these questions, we didn't create them. They came from the Search Institute and were particularly in response to the recent uprisings and the stress of those events, as well as looking at their beliefs around them. So I don't know if we have much control at looking at that, but it certainly gives us information about how the students perceive these things. And I think speaks to students really, you know, they feel strongly about it and feel they have a role in it. And so we need to help them figure out what that role is and, you know, how to navigate that. So, I think that's not just schools, but within the community and homes as well.
And if I could just chime in on that a little bit, you know, the whole idea of tolerance, you know, when I hear that word, tolerance to me means putting up with. And, you know, the word tolerance when it comes to equity and diversity, I think that's a word that is not going to be a really useful one in terms of really making some changes of being a part to reduce any racism or racial tensions.
So I wasn't using that word tolerance as putting up with something. I was using it more as accepting people, accepting differences, accepting the way that you treat, you know, the people are, you know, not to accept bad ways of treating people, but accepting a policy where you treat people equally. You know, and that to me is being tolerant. I'm not saying I'm in charge now because I have power, but rather I'm in charge now and now we can treat everyone equitably. That's more of a way that I'm putting, and not to put up with differences, but to accept differences.
Thanks for that clarification.
So are there other questions or comments on that part that Val just presented around the racial injustice and also the coping with COVID kind of module? So it doesn't seem like it right now. Obviously, you can send us more questions afterwards. We can continue that discussion. In terms of the next steps that Val put out there, you know, we have, like we mentioned, we have the ability to dig into this data in many ways. So Robin, you had that question before about how to, you know, the kids with the lower sort of developmental relationship scores, does that correlate to? So we can do that level of analysis. I think we want to really dig into different demographics, like find out which are our kids that are highest risk. You know, do we have differences in patterns? But actually the report itself already breaks things down by boy and girl, but we have the ability to look by race, by gender, by sexual identity, and really identify groups that are at higher risk so that we can also then target supports or education to those groups. So that's some of what will happen. What I think we could do with our last remaining, 12 minutes is talk a little bit about what you guys would like to see happen next. Who is interested in maybe being a part of a discussion around what would a freshman forum look like? And I want to have so I think we want to do that. And it might be just putting your name in the chat if you're like, I'm available and want to do something this summer. But I also think that, hi, Elaine, I think we would be remiss not to just comment further on the fact that we've alluded to the fact that marijuana legislation is happening like right now. So the Senate is debating today in the special session. The House will debate tomorrow. There is a new bill number again. So it's now a third bill number. Melissa, do you have it at hand? If you can put it in the chat if you can grab it and put it in the chat.
Yeah.
What I want to comment on is, this is like high politics right now, what's going on, like votes are being negotiated and whatever. But if you have strong feelings in any direction, I won't say how you should vote, but I will say you can contact your legislator, and that would be a phone call or an email, preferably a phone call today or tomorrow. By midnight tomorrow, this is all done. So whichever way the vote goes, I think has strong implications for further implications for how we educate people around marijuana, because the law is going to be the same or it's going to be different. Perception of harm is already low. It will likely drop. Access may increase. It would, if it's legalized, it will be legal for 21 and up. But as Kevin mentioned, I think it was Kevin alluded to the fact that there are not severe consequences for underage use in this bill. And so I think there's going to be need to really support first responders, law enforcement in enforcing what they can. And there's going to be a lot of need to respond.
As a community member, there's some things in that bill that if your parents are a health professional, you should be concerned about. There is no cap on pre-filled vape cartridges. It puts a cap on other forms of marijuana, but not on pre-filled vape cartridges. Also prevents law enforcement from pulling someone over if they're driving and smoking a joint. So that's also concerning. There's also no required health warnings on the packages, other than these items should not be sold to anyone under 21. So there's a few kind of glaring omissions in the bill that if you have a relationship with your lawmakers, it's worth pointing out.
And unless anything is changed as of last week, I was in a meeting where we were discussing some of the language in there. I believe it was for possession of 5 ounces or less if you're under 18. There's no court involvement until the third arrest. The first 2 were just referral warnings.
They changed it to a written warning from what originally was under 18 possession was going to be a warning. It didn't even say written. And then there was the option of referring to the Youth Services Bureau, but not even Juvenile Review Board. I haven't gotten through the third version of the bill. Each version of the bill is like 300 pages. So the one last night that came out while we were in front of the Board of Ed until 10:30, I haven't gotten through, but I didn't see a lot of changes. Did you, Melissa? Or Ingrid?
Yeah, I've been dipping in and out. I've been busy. There are a lot of amendments being offered. I don't know how many of those are going to come to vote. The lack of a THC cap on pre-filled cartridges when we know that's the product of choice for young people is really distressing to me. And I can't find anyone and I've asked multiple legislators, I can't find anyone who can tell me who put it in and why it's there when we're capping. They cap plant matter at 30% and they cap concentrates. So the other, like the wax and what's in food, like that's at 60% rather. So it's 30 and 60, but pre-filled vapes are explicitly excluded from caps, which is extremely alarming. If you have teenage brains who live in your house, I think that's pretty concerning.
And just to point to the value and the value of advocacy, the first version of this bill did not have any caps on the amount of THC in the marijuana product. And the caps were added in a week ago, Friday night, after a conversation among advocates happened earlier that day. And as far as I can tell, it started with like one text from one legislator to a constituent that they had a relationship with. And the conversation went around a group of folks and everyone started saying, let's ask for a cap. And they put it in that same night, Friday night at like 9 p.m. last week. And so voices can have an impact on saying, you know, so whether you think, you know, it should be legislated or not, I think we want to make sure that protections for health in there. My pet peeve is that the marijuana revenue funding should be going into prevention, treatment, and recovery around mental health and substance use right from the beginning, which was not how it was written at all. So you can have an impact even at this late date, but tomorrow night, midnight is the end of that.
Yeah, prevention money doesn't happen until year 3 in the bill. So the first 3 years, the money goes to the general fund.
And the social equity fund and the social equity fund.
And then year 3, it's social equity and prevention, I believe, right? 75% to social equity and 25% to prevention and treatment.
That's what I'm hoping got changed in the new bill last night, because I'm not talking about the amendment, I'm talking about the new bill. And so a couple legislators said, oh, we think we took care of that. And I'm like, show me the writing about that. But
I haven't seen it.
So okay, so we did our little marijuana advertisement here. You guys, you know, let us know if you're not sure who you call or who your legislator is. But with 6 minutes remaining, I saw a couple people in the chat said that, yeah, they'd be interested. People are giving us their email if we didn't have it. Trami, if I'm saying your name right, interested in working on the forum, which is great. Is that how you pronounce your name?
Can you hear me?
Yes, now.
Yeah, I go by Trami.
Trami, okay.
Okay.
Thank you. Well, it'd be great to have you work on that. So I think, you know, freshman forum is one thing, responding to the marijuana bill, educating parents and youth, I think would all be things that we've discussed today. In the meantime, we're also finalizing our last few postcards. So if anyone wants to work on the existing postcard series, just, you know, let us know, because we've got drafts of the last few that, you know, there was a gap between the first 3 and the most recent one that's probably in your mailboxes like today. And that's because in between we got the survey results. So now the postcards can have actual Westport data in them. So the 4th postcard has current data. So if you want to work on postcards now, let us know. If you want to work on parent education or any of this other stuff, I guess, then please join us on
July 6th.
Yes, July 6th. Let's put that in the chat. Next meeting, July 6th. And if you can't, you know, make it then, but you want to be involved, then let us know. And would that be, Kevin, would this one be on Zoom or would this one be live?
Oh, that's a good question. Yeah, I think it depends on how many people we have. You know, just finding the space where we could safely meet. So maybe we can put out a poll in advance just to see who would be available and get a rough estimate of numbers. But I was just going to say that, I mean, the nice thing about the postcards and the freshman forum is it's starting to get into that, you know, we always ask, you know, how do we hit parents and educate parents who may not have it on their radar, who, you know, aren't necessarily going to come out to, you know, the forum, you know, just the, you know, Tuesday night event or whatever we have. So how do we, you know, reach that broader audience? Get creative with it.
And we did have a couple of events that, you know, were like MAD did their talk for us. We had that film. They did it a couple times. That was Power of Parents. We had the film If They Had Known. Those things were all on Zoom and everybody's so zoomed out. But I guess the other thing to mention is we can start doing those things in the community again. So that's another thing where if any of you is like, I want to offer this for my parent group or my some kind of club or some, you know, or I want to plan it for my PTO for the fall, let's start planning those things. We can do them live now. So I'm also going to just show, in case we showed the marijuana postcard, if anyone hasn't received these, this one is the kind of mental health and coping with COVID postcard. And then this was the alcohol postcard, especially focusing on the social host law. You can also see all of these on the Westport Prevention Coalition page of the Westport Together website. So any final comments from anyone or thoughts? Then we can wrap it up 2 minutes early, you guys. I hope everyone's, I think for those of you who are in school in any way, teacher, parent, kid, graduation, whatever, get through this week, celebrate this weekend, do it safely, try to stay sober, and we will see you hopefully on the 6th. Thanks for your time.
Thanks, Margaret. Thank you, everybody.
Bye.
Thank you.
Hey, Angelica.
Hey.
All right. I guess we lost everybody here. Good. Turn off recording.